Hi everyone, my name is Koh Elaine. Today, me and two of my partners who are from Group 7 will present a journal club with the topic American Cancer Society Guideline for Diet and Physical Activities for Cancer Prevention. The other two partners who are going to present this journal club with me are Azlina Chua and Aminul Haqim. This journal was conducted by Cheryl L. Rowe, PhD, RD, and her colleagues on 2020 and was published on American Cancer Society. For the presentation outline of our journal club, we have included the introduction, methods, data and results, discussion, and conclusion. For introduction, the background of our study is to study about the recommendations for individual choices regarding diet and physical activities patterns. Next, the objective of study is providing guidance, support, and evidence-based strategies for individuals and populations to reduce cancer risks. Advance the mission of the American Cancer Society, ACS, which is to save life, celebrate life, and lead the fight for a world without cancer. However, the hypothesis is specific recommendations targeting the risk factors have tremendous potential to reduce the cancer burden.
Now, let's see the methods that are recommended by the American Cancer Society for Cancer Prevention. These ACS guidelines and its recommendations are consistent with the World Cancer Research Fund WCRF guideline. First of the method is to achieve and maintain a healthy body weight throughout life. Based on the research, excess body weight contributed to a higher risk of death from coronary heart disease, diabetes, and also some types of cancer. In year of 2000, an International Agency for Research on Cancer IARC expert panel report showed that excess body fatness causes cancers of the female breast at postmenopausal, endometrium, and also kidney. There is also evidence from large pool analysis studies that adult weight gain also is associated with the risk of cancers of the gallbladder, thyroid, pancreas. To control our body weight and fatness to prevent those cancers, we need to keep our body weight within the healthy range and avoid weight gain in adult life by being physically active and also have a healthy diet. The USDHSS Physical Activity Guidelines for Americans in 2018 recommend that adults should move more and sit less because some activity is better than none. It is estimated that 1.5% of all cancers diagnosed in the US during 2014 in men and 4.4% of all cancer diagnosed in women are attributable to physical inactivity, as are 1.4% of all cancer death in men and 3.0% of all cancer death in women. So, how are we going to be physically active? First, adults should engage in 150 to 300 minutes of moderate intensity physical activity per week, or 75 to 150 minutes of vigorous intensity physical activity. Achieving or exceeding the upper limit of 300 minutes is optimal. Second, children and adolescents should engage in at least 1 hour of moderate or vigorous intensity activity each day. Next, the PAGAC concluded that there was moderate evidence linking prolonged sitting time with a higher risk of colon, endometrium, and lung cancers. So, we need to limit sedentary behaviors such as sitting, lying down, and other forms of screen-based entertainment. Third, follow a healthy eating pattern at all ages. Diet and nutrition are important determinants of cancer risk. They contribute to energy balance and via biological mechanisms that alter risk independent of body weight. A healthy eating pattern includes foods that are high in nutrients. This helps to achieve and maintain a healthy body weight. Second, vegetables and fruits are complex foods with a variety of colors, each containing vitamins, minerals, and other bioactive substances such as sterols and phenols that may help to prevent cancer. They are also low in energy, high in fiber, and have a high water content, which may increase satiety and decrease overall energy intake. This each should contribute to weight loss and maintenance of that loss. Third, 100% of the original kernel is retained. Whole grains may lower colorectal cancer risk through modifications of fatty acid productions, lower levels of pro-inflammatory bacterial species, and by accelerating gut transit times. Next, let's see what type of eating pattern should be limited or does not be included in our diet. First is the red and processed meats. The World Health Organization's WHO in 2015 states that processed meats as a carcinogen related to colorectal cancer and red meat as a probable carcinogen that increases colorectal cancer risk. Second, limits the intake of sugar-sweetened beverages. These are associated with risk of weight gain, overweight, and obesity, which itself is considered a cause of 13 types of cancers. Third, highly processed foods should also be limited. The processed foods tend to be high in fat, added sugars, refined grains, and sodium. They have been associated with adverse health outcomes, including cancers, in a small number of studies. The fourth method is to advise people not to drink alcohol at all. This is because alcohol consumption is the third major modifiable cancer risk factor. IRC expert working group found that ethanol in alcoholic beverages is carcinogenic to humans. Thus, alcohol of all types of beverages increases the risk of cancer. Those who choose to drink alcohol should limit their consumption to no more than 1 drink per day for women and 2 drinks per day for men. Lastly, is the recommendation for society to prevent cancer. Public, private, and also community organizations should work collaboratively to develop environmental changes that increases access to nutritious foods, accessible opportunities for physical activity, and also limit alcohol for all individuals. It is critical to recognize that social, economic, and cultural factors, as well as policy, can influence diet and physical activity behaviors.
Let's see the data and results. From the data in Table 2, which is the evidence for the role of weight management, physical activity, and diet for the prevention of cancer by various sites. Let me explain one by one, starting with the role of weight management, then physical activity, then diet, and lastly alcohol consumption, in preventing each type of cancer that can be seen in the first column of the table. Excess body fat may increase the risk of cancer at a variety of sites, including colorectal, endometrial, gallbladder, kidney, liver, ovary, pancreas, and thyroid. Patients with excess body fat and increased weight gain at the breast site will have an increased risk of developing cancer, especially after menopause. Having excess body fat at the prostate may increase the risk of having advanced prostate cancer, while gastric cardiac cancer at the stomach sites and esophageal adenocarcinoma at the upper aerodigestive sites. Next, physical activity can prevent cancer when being done from regular to moderate and vigorous physical activity, and reducing sedentary behavior or time can reduce the risk of developing cancer at sites such as colorectal, endometrial, kidney, liver, lungs, ovary, pancreas, stomach, and upper aerodigestive. It is noted that at the cancer sites such as breast, having moderate, regular to vigorous physical activity may lower the risk of having postmenopausal and premenopausal disease. Different cases when dealing with the stomach site, when having moderate, regular to vigorous physical activity and reducing sedentary behavior may lower the risk of colon cancer, but not the risk of rectal cancer. Let's proceed with the diet habit. It can be concluded that having processed meat and red meat intake, even in a small amount, may increase the risk of having cancer at sites such as colorectal, lung, and pancreatic site, and may cause non-cardiac gastric cancer in the stomach when taking processed, grilled, or charcoal meat. Having a higher consumption of dairy products and calcium may increase the risk of having prostate cancer. Eating a dietary pattern rich in plant foods, non-starchy vegetables, whole fruits, and low animal products may lower the risk of having cancer at the breast, colorectal, lungs, and stomach sites. At the liver sites, consumption of fish can reduce the risk of developing cancer at that particular site. Finally, alcohol consumption may increase the risk of developing colorectal, liver, and stomach cancer. It also increases the risk of oral cavity, pharynx and larynx cancer, and squamous cell carcinoma of the esophagus for upper aerodigestive sites. It is also noted that for breast site, alcohol consumption may increase the risk of developing premenopausal breast cancer and postmenopausal breast cancer.
For the conclusion, authors conclude their recommendations for community action have tremendous potential to reduce the cancer burden. Public, private, and community organizations should work collaboratively at national, state, and local levels. First is to develop, advocate for, and implement policy and environmental changes that increase access to affordable, nutritious food. Next is to provide safe, enjoyable, and accessible opportunities for physical activities. And last is to limit access to alcoholic beverage for all individuals. That's all for our journal club presentation. I will end up my presentation with Q&A session. So feel free to ask us or drop the questions in the comment. That's all from us. Thank you for lending me your ears.